Healthier Together, sponsored by Regents Blue Cross Blue Shield of Oregon.
This gives hard data on where the holes are, where we're missing services, why folks don't access services.
Shining a light on the needs of LGBTQ plus older adults. That's the focus of a new first-of-its-kind report and today's Healthier Together. Our population is aging, but until now, LGBTQ plus older adults in Oregon have largely been left out of the conversation, their unique challenges, needs, and resources. This executive summary from the Oregon Department of Human Services provides that data.
One of the biggest things I think that came out of this is the fact just how important it is that service providers are LGBTQ competent, that they know what the community is and how to service community.
To help understand some of the findings, I went to LGBTQ plus consultant Stacy Rice and Senior Medical Director of Behavioral Health at Cambia Regents, Dr. Mike Franz.
Growing up without a community or an environment that is as supportive as it is now, although we still have quite a ways to go, makes their experience uniquely different.
I mean, if you look back at folks that are LGBTQ plus older adults and elders, I mean, the times that they've gone through during their lifetimes of just having to be totally in the closet, couldn't be out, just facing massive discrimination, violence. I'm a trans woman. I came out in 1999 and transitioned then. That's 22 years ago. Things have changed a lot since then.
More than a fifth of the LGBTQ plus older adult participants in the survey say they experienced suicidal ideation in the past year. That's significantly higher than the general public.
Unfortunately, folks that are older, that identify as LGBTQ, are significantly more likely to experience some behavioral health conditions, whether it be anxiety, depression, or substance use disorder. The critical first step is to acknowledge that there may be an issue and to seek out some help.
But the report found there are serious barriers to getting that help. More than half of the survey participants have service needs that are not met. Among the most common challenges, high cost, and the experience or fear that services are not LGBTQ plus inclusive.
A big part of that actually is just the fact that people are hesitant to go to services because they don't know how they're going to be treated, if they're going to be discriminated against.
The report found nearly 60% have experienced discrimination within the last year.
Most folks go back into the closet because you don't know how the people around you are going to react. How are the folks who run the place that you're living, how are they going to react?
Nearly a quarter, 24% of respondents say they've experienced elder abuse in the past year. And more than 3/4, 76%, did not report that experience to authorities.
They also tend to live more in isolation. Older adults who identify as LGBTQ are much less likely to have children and also to live alone and age alone. And without the caregiver support, sometimes it's more challenging for them to meet their needs.
This report highlights the importance of healthcare and other service providers to be competent and compassionate to the needs of LGBTQ plus older adults. Rice hopes it'll also better inform lawmakers in Salem to improve resources around the state.
I think one thing it boils down to that we just want to treat everyone, as human beings and with compassion and care.
Brittany Folkers, KGW News.